So today is it's a crazy day. We are one day out from heading to CCATT Advanced, and we're actually on a pretty long break. So I'm going to CCATT Advanced, and then I have something in store for you guys the more that you follow this vlog. What's really good on my day ones? Welcome back to the channel. So it's been a while since I've vlogged like this, and every now and then I like to speak to you guys. I like to talk to you guys, and I like to get to know my audience as well, as much as you'd like to get to know me as well. I try not to expose too much of my private life, but enough so therefore it keeps you questioning how I am as a person. But every YouTuber that you'll ever meet, there's like this preconceived notion of who they are. But I hope that you get a pretty decent one of me, so therefore when we do meet, you're like, he's exactly like how he is in the videos. As you saw, we were packing, and we should be heading out in a couple days. But you know what? I'm gonna catch you guys up. I'm gonna fast forward all the boring stuff. Let's go ahead and jump to CCATT Advanced. So we are here in Cincinnati. Whoa, lighting sucks. We are here in Cincinnati. We are here for CCATT Advanced. This is the harder, more difficult portion of CCATT. As soon as you get into the room, you have this mini kitchen area right here. Give us this little couch. Couch. There we go. There we go. Yo, let's go. Boy, I thought I was gonna be able to talk more to the camera. However, it's just been a hectic, chaotic, and just overall tiresome week. Been cumbersome, honestly. I wouldn't have it any other way because this training is actually exemplary. This is some pretty hard stuff. So I have been studying, and usually I don't study. I've been studying more than I should, and just trying to get the flow of what really needs to happen with these exercises. Now, I can't really tell you what happens during these exercises because I'm being tested the whole time, and for me to leak what needs to happen or what these simulations we're doing are like, it's part of my academic integrity where I tell you that I cannot share that with you. However, I can share that it is fun. Touch base with you again once this week finishes, which is validation week. In validation week, we do a simulation every day, and we're tested upon our ability to act on the JTS CPGs. For those who don't know what that is, it is the Clinical Practice Guidelines. Boy, day one of sims. Let's talk about it. So, I cannot tell you specifically what the sims were or the cases have at it, and that's just because anyone who aspires to go through this program and does get selected for candidacy, let's just say you need to review, and the importance of reviewing plus the importance of nursing experience, once those two coincide, that's when you see beauty in this program. And if I did not have strong bedside experience, I believe that I would not have done a great job. And what I can talk about is regulated versus unregulated missions. Regulated, it goes through the hoops of we're gonna pick someone up from said base and we're gonna bring them home to said base. That's what regulated is. Unregulated, wartime. Let's say we're dropping by a base, and then all of a sudden an IED blast happens with a patient. We're bringing our airmen home, or we're bringing our troops home. That's just how it is, and you don't know what kind of casualties you'll get. So that's what an unregulated mission is, and it's just making sure that they live. Besides that, I'm gonna do these daily check-ins and see how we progress throughout the week. That was day one, so I'll see you. So I'll talk to you tomorrow on day two, or after day two. Damn, I feel like I'm having an existential crisis after today's sim. I wouldn't say an existential crisis, I would say more of a, we did fine, we did good. So we did an unregulated mission today. The unregulated missions entail exactly what it means, unregulated. I want you to think of of when we were at war with Afghanistan and Iraq, and they were picking up patients not knowing what kind of patients they were going to pick up and what had to be done with very minimal information at times. That's exactly what it is. So yeah, that was today, and today was it was kind of a tough day, but it wasn't bad. It wasn't bad at all, and we got 3 more. So again, I'm doing this day in, day out to keep you guys posted, just so you guys have kind of like a measurement of what you're gonna be seeing or feeling throughout your CCATT journey if you're going down this road. So let's just say try to sharpen the sword. Iron sharpens iron. So yeah. All right. So day 3 of Sims is over. Fell asleep. I was tired. However, I will say today was a lot better than the past 2 days. Critiques. The most important thing that you are taking away from the CCATT program is the critiques that they give you, and it's only to sharpen you as an ICU nurse, especially if like you're a doctor or RT. You have someone who is in your specific field who is watching you constantly throughout these exercises. They will give you feedback at the end, and it's like one of those things you shouldn't take the feedback to heart. You should take it and grow with it. And I did that, and today was a lot better than the past 2. And yeah, that's day 3. We have 2 more days, and then we head back to San Antonio. Day 4 out of The Sims. What an amazing time this was. Retrospect, I want to say it has been the best training I've ever had. It's prepared me as a trauma nurse, and basically all the experiences I've ever had as a nurse, it's come into fruition, and it's created a CCATT nurse. Tomorrow we'll find out the final results, but the past 2 days we had decent Sims, and we can only go forward starting tomorrow, and hopefully it's gonna be an amazing time tomorrow. So one last check-in tomorrow before we head back to San Antonio, and I look forward to it. All right, so I didn't get that last check-in only because I had a high on passing that course, and a lot of people for the most part passed the course, and believe it or not, there are people who fail. In the CCATT realm, you have to be prepared for unregulated and regulated missions, as previously mentioned. The last day of exercise was a unregulated mission, and it wasn't a hard mission. It was just very tasky, and if you are a nurse, you are going to be task saturated. The thing about these simulations is it's meant to push you to your limits and see if you will break under pressure, but you shouldn't be doing that, especially if you have like really good nursing experience. So I really don't have much to talk about for the final day. However, I will say this: for anyone who is striving for either CCATT, AE, anything of higher tier, you will always be faced with harder things. So don't take it personal when people critique you to become better. Take it with a grain of salt and run with it. One day, when that fight comes to us, or we go to that fight, you will be called for a higher and greater mission, and you are going to need every bit of training that you trained for to deliver top tier care to the people who are being injured during these times of peril. I apologize I didn't get enough footage, and I wish that I got more of like the things that we did there, but like, honestly, I don't want to spoil that for you, and I could only show you so much for you to look forward to. However, you will decide that, especially when you go forward to go do bigger things. So if you are striving to get to that level, or to the level of CCATT, I say take every experience that you can that challenges you, that pushes you, and that makes you a better nurse. So therefore, when you do come across this situation, you know your level of hard and the level of task saturation that you could take, and you could be critiqued and easily molded into a CCATT nurse. I wanted to get this uploaded before it's too late, and it's been about a month since the course finished, and a lot has happened. So I have more vlogs coming out. OTS is now 2 weeks, which that video is to follow. I interviewed one of the people who I mentored who went to the 2-week course, and that'll be going up probably sometime this week or next week. So hope you guys are doing great. I'll see you guys in the next video.